I'm coming from a very, very old family of Venice. And I needed to explain to you why I have this kind of, which is the way we need for arriving to where we are. And I try to stay here, otherwise it will be hard. And here you can see something that I show, but I would like better not to show but to make you test. Because it is our, as you can see, 13th century wine cellar. So it means that from generations we have something that links us to nature. And if you think, well, what is wine? Where are some things? What is wine? You never thought of it? It's so natural. It's something that we do without any chemical intervention. Just hands. And the good God, that I think also in England recognize it, more than, probably more, no, less than the Queen, but there's God there. And which is the last dinner was wine. It is a clear expression of nature, but also of how important is wine in our life. Obviously, microdoses. Otherwise, we will speak again with our friends of this morning, right? Okay? So, love for nature. On the other side, chemistry. On the other side, medicine, because my grandfather, okay, excellent. He was the director of the Padova Hospital and University in the 19th century. And then you can understand that from my father, my grandfather, I have this origin, very medical and very nature. And from the other side, there's a pharmaceutical group, chemistry, pharmacists, and which was a link between both. There was this one, cows, a very large passion for nature, cows, and so on. And in March 1950, normally, you know, when a veal, how do you say, a little calf, right, correct? Calf, born, people call the owner and say, we have a new calf and so on, right? Obviously at the time it was not so easy. There were this phone, okay? Ring, 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 hello. In Italy it was pronto, ready. So the 9th of March 1950, there is a call at 2:40 in the morning. And my uncle answered, and the man voice told, he's born. It's a boy. And my uncle answered, from which cow? The cow was my mom. So you can understand which is my important route. So I have a mix of all these experiences. And why I'm speaking about it, I don't mind the company because there's a lot of things I can speak about. It exists, it's 1,800 square meters of land. Okay. I speak of it because it's something very important. Why I I spoke about memory, about my roots. In your opinion, I don't want to disturb your husband because he didn't take in charge today. He take it. So this is the reason why it was so. Okay. So why? I asked to you. Yes, lady.
Because some of the past is still in us and the physical makeup today.
Very well done. Very well done. Because we have in ourselves a memory. Somebody can help me and say to me, how many cells are we? Trillions? I'll try to be more precise. The average is 30,000 billions of cells. Not bad, huh? And how many cells need for being ill? One. So you're very clever. Yeah, that's fantastic. Thanks. Thanks. One. And what normally we do think for trying to solve the problem of oneself?
Research.
Yeah. To everything but the cell. We look for the receptor, for the enzyme, for that. And we forget one thing, that we are cells. And the cells have some characteristics, which are one of the men more important in terms of philosophy of life is this one. Look at the definition of health. He didn't speak of disease. He speaks of health. And we are anytime forgetting this. What is health? A transition state that doesn't promise anything good. Why? Are you well, sir? I'm very happy. But it's more easy to fall ill than to return to health. It doesn't mean that you have to prevent something, because you cannot prevent. You can increase your barrier against disease, but not prevent. Otherwise, everybody will live, for a lot of years. Okay? So what we can do is try to avoid all the things that could, but we cannot control. You know, there are a lot of companies that sell products that you have to take for life because it works. Now, which will be the proof that it works? You're very attractive in the sense that, you know, everyone has a personal magnetic field. Okay? I feel very proximate to you. So, have you any answer to give me? I'm speaking now as Italian. I have not taken Italian, the Latin level, and so on. Now I finished. I am too old, unfortunately. It's just a feeling, right? It's just a feeling. Okay. The question was... this is my problem. She didn't answer my English. She was very attentive. So the question is, how can you test if the product you take during your life that should have you avoided from cancer, from all diseases, from chronic diseases and so on, and make you live for years and years more, how can you test if it works?
Test it when you're 100.
No, you cannot test it, because when you will die, you cannot say if you will die, if I am died because today, because I took this product, or so you haven't. So your health is yourself, right? So what does it mean? That you cannot prevent cancer or preserve life because you cannot know what will happen. You can do everything is possible following the nature. This is one of the things that is more important to see, right? And then we will see. So, what means this? Means that we have to pay attention to everything because this is the key point. And the problem is to think to the key point in a certain way that is this basis. What is this? May I use something that is called In Light, the Wellness Free Group? Is it free? I don't want to pay hospital tonight. I just to pay the hotel is not true. And the hotel, the flight and so on, I don't want to pay also this. So I can use this, everybody, okay, you understood, huh? So, right. What is this? It doesn't work, so. What is this? Which cell? Cell. We have 30,000 billion cells. This is just one cell. Women, sorry. Which kind of cell could be it? I try to show you the second one. In this case, they will answer immediately. What is this? Spermatozoa. Right, I've seen her. And now what is the second one? And no, we will know how you say in English. An egg. You say egg? No, it's not an embryo. It's an ovum. It's not yet, right? It's not. Yeah? She's speaking as a doctor, so you have to forget it for some minutes, please. Forget it. We are down. We are going down. No scientific. Okay. So this is novel. And this ovule has all the memory of the mother. And the memory is not only the chromosome and the genes. There is a lot of memory inside. And we will develop this point. On the other side, this is my father. The go. Here is the history. In French they speak about when you have the impression you have déjà vu. Bravo for saying that. It's something that is in our memory. French people are not so clever as you are. But sometimes they are able to do something good. Why? Certain ideas, the 68, the French Revolution, I'm not sure of it, but and what is coming here? This spermatozoid is coming here, and finally you have here how many cells? How many cells you have there? This egg ovule with the spermatozoid inside. Is 1, 2, or more cells? 1. 1. That is only one memory. Okay? Is it clear? So, this means that after 9 months, we become, in this case 20 probably, 20,000 million cells. And how can you define all these cells? How can you say? Give me a definition of this. A human being. How can you define it? The baby. This is a common way to call it. But how can you represent it? Is what? We speak about cells. So cells are our key word. Okay? So how can we define it, speaking about cells? You are the first to speak about it, but can you say to me, what is it?
A complex
structure. I can say that, if I say that this is 20,000 billions of cells. It's not correct. Because in this case, I haven't a form. It's a complex.
Complex.
This is very important, this word. Because complex means that all these cells speak each other. Very important. Speak. I said speak, it's not correct. All these cells speak together. They are linked together. But not 1 + 1 + 1. But creating this complex. Absolutely that. They speak each other. Well, this morning you learned to the first discussion of, I'm sorry, Dr. No, don't worry, I don't remember your name, I'm sorry. Okay. And?
Santiago.
Okay. Artist, Dr. Artist. Okay, thank you. And we speak with, but the name is okay. All the speakers this morning, the light one was the one who spoke with light. He spoke about what? Then, sorry, I don't remember your name. I'm sure that if you had my name, Gaetano, I should remember it very well. Unfortunately. So, what is it? He said that the light with the light. He speaks. Okay. Okay. This is very important. We are complex. Otherwise, we can cut and say, okay, I don't mind. Oh, no, cannot. And remember, one thing is very important. At least that, as Italian, my first reaction was to help you immediately, you see. That's it. So, what is very, very important, speaking about cells, what is very important? It's considered one thing that has been discovered late. That is the function that creates the organ, and not the organ that creates the function. This is a key point that is in the mind of scientists, not since 50 years, right? When I was a young surgeon and I entered in the room, surgery room, my great, how do you say, master, professor, okay? He said to me, ooh, pay attention, do not touch a liver. Because if you touch a liver, there are a lot of risks, okay? Now, you can cut the liver and leave a little muscle, a little piece of liver. And what happened to liver? Fantastic. Fantastic. It's changed completely, huh? So, what we are? A complex of cells that are clever. Very important. We forgot very soon this. That I have a memory, and a specific function. This is a very, very important key point. And we don't mind. Which are the problems involved? Mitochondria, reticulus, and so on. We don't mind. Because we are not discussing about it. Probably we, in the past, we under-considered the plasmic membrane, but this morning somebody spoke very, very well about this. Okay? But otherwise, which is the key point here? Here the key point is that this cell can work only if it is well nourished and well protected. When itself stops its function, what happens? The first thing we do in the morning, what is it? You know, unfortunately, I am no more waiting lower. Never. You know, we need to. But I have also problem. So he's still a Latin lower. Yeah. You will explain to me how to do it again. So I haven't understood you said.
I said have breakfast.
I'm not sure that it's the first thing you do.
Brush your teeth.
You brush your teeth? Okay, probably you did something else before.
Wake up, wake up.
You waste, okay, you eliminate, right? First thing you do is to go to the toilet,
Yes.
right? Okay, some men with the prostate problems probably is not the first thing because they had to go 2 times before during the night. But, at any case, the first thing. Why do we need as first thing to go to the toilet? It's too long, Jeff, or it's okay?
Oh, perfect.
Okay.
You can go all day.
Huh? It's okay? So, why? Why?
Body's been getting rid of the waste, been working hard all night.
Well, you speak a perfect Italian. So, no, I try to speak a little bit. No, they understood very enough.
Your body's been working hard to actually eliminate the waste while you've been resting. So it needs to be then.
Wow. So I can go away. Yeah, that's true. We forgot that our cells has. Yeah, you say has? Yeah, our cell has. Yeah. A daily life. And I have also 2 other cycles. So 24 hours cycle. Then
Lunar cycle. The lunar cycle.
if you think to moon cycle, yes. Third season circle. That we have completely forgot again. Huh? Well, the moon, everybody understand. 28 days. This is typical. This shows also that we have a magnetic field because we are sensible to this, right? And the 24 hours, why do you have a 24-hour cycle? That corresponds to what?
The revolution of the Earth on its axis.
To what?
The revolution of the Earth on its axis.
The Earth spinning 24 hours.
Yes, I think that if I can reduce it in a little bit less important concept, is the sun. Is the sunlight, right?
Oh, yes.
No, it's right. You're saying. I am saying. I'm going to simplify, right? Okay. I try to simplify very in images that are very clear, right? Why the sun is very important? Why the light is very important?
Energy.
Life-giving. And secondly, or first, is the sun that gives energy to our cells. Never thought about the problem of depressive people? Which is the difference? If in the audience there are therapists, practitioners, therapists, and so on. Which is the question? I am a patient, okay? I come. Are you a therapist?
Yes.
Yeah. I know. I'm sorry to disturb you, but I'm very stressed. I don't know what to do. What should I do? Which is the first question you put to him? To me.
About the nutrition having
Yeah.
lifestyle.
You are using too much your neurons. Stay. Which is? Because if you begin to say this, you don't know. This is a secondary. This is right, but the secondary question. You do not know if the stress is the stress of fatigue or if the stress in the sense of depression. Okay? Right? Which is the question you have to do for understanding if he needs more recharge or more unwind. Right? Next time you put, next time I will stop you and you will use an Italian name, alright? Right? So, which is the question? It's very easy, it's very easy.
You speak what?
You know, when you say this, our problem, you are a doctor or a therapist, okay, it's fantastic. You said to me yesterday, I think. Okay. The problem is that we have to enter in the language of our patient, otherwise we are not able to understand it. Mutually, I mean, huh? So, which is the problem of these people, of myself, that I'm stressed? The question is, are you better in the morning or are you better in the evening? You ask me and I say to you, I'm better in the evening. What do I need, Esther? I'm weak because my stress is linked to something of my daily life, right? I am better, and the sun is normally hated. How much is that not hated? By the stressed people, by the people who is depressing. They don't like it, right? You are perfectly right. They sleep very bad. You are perfectly right. They awake very bad, very fatigued. Okay. Otherwise, your husband, huh? He's stressed because at 4 o'clock. Huh? He is, how do you say, stress in terms of fatigue, huh? How do you say, tired.
Knackered.
So, you take my charge, okay? And during the night, take yours, you also tired. It's perfect, huh? I'm joking, but it's true. Huh? The center of urology of Rome used recharge for the problem of men. Okay? So, I'm joking, but it's true. And there is a very deep reason that you will understand after. So, it's clear what I'm saying, right? Everything is linked to the messages that our cells gives to our brain. Because our brain is the one who decides which is the answer to give. But in reality, the answers are linked to the questions. Right? And this is also the explication why we have so many autoimmune diseases in the last time. Because the messages we send are messages that are modified, but not by our decision. Sure, it is important. By the fact that something happened here. We will go deep in this question. So, look at this. I was saying, first of all, we go to toilet. We eliminate, because during the night, during the rest, we metabolize, we renew ourselves. So we consume also. So, we need then to have breakfast. Oh, English people need more breakfast than the Italian one taking coffee, but this is just for chromosome and historical reasons, right? And afterwards, what do you do? Yes, but if you go to work as you are when you go out of your toilet, there are a lot of men that would be happy, but probably not so well protected. So you dress. So what are you going to do? You are going to protect yourself, right? This is very important. Because if you do not protect yourself, you are continuously under the attack of everything you have around you. Then you come back, so you go work, you work, then you stop work, you go back, and what do you do when you go back?
Eat.
You eat again. Why this? Because you have consumed, but you need also something for the night, because otherwise the cells will be without energy during the night, right? And you waste it before going to sleep, and then you go to sleep. Go to sleep means what? can simply stop actions. And stopping actions means that finally your cells can recharge themselves. I'm trying to remember your name that I heard during the lunch. Yeah, your first name, yeah. Louise. I would think that you have a French name. So, Louise. So, you understand what I mean? Think simply that the circulation cells renew during the night, normally between midnight and 2 in the morning. So, if I ask you why do we have the jet lag, you will answer to me what? We change habits ourselves. It's not so easy, right? Our girls that go with Saturday night fever, okay? They enter at 4 o'clock, 5 o'clock in the morning, probably 6 o'clock, I don't know. They can sleep all the day, but they will be very tired during all the day. Because we didn't gave the possibility to cells to restore. And this is true for everything, okay? So, what happens when something, whichever is the origin in your mind, the first thing happens and we have an imbalance. We stop before function because the cell has to be renewed, has to recover itself. So this is the reason why it stopped working. Because if it continues to work, what happens? She will not no more protected, and at a certain moment she will be destroyed. And which are the reaction of the other cells? Is to double their function. Yes, but in this way what happens? They consume a lot. So at a certain moment, you understand that? You understand that in reality, when you are in this moment, these cells need to be nourished more, stimulated and functioning, because they are functioning 200%. And these cells that stop functioning, they need to be protected twice almost, right? And so on and so on and so on. Flu. How much hours before the incoming or the outcoming of the flu we feel that we will be ill? 24 hours, normally, okay? And in reality, we do not have the symptoms. We have this perceiving. What is happening? We are consuming all the capability we have, the whole capability we have of defending ourselves. And when we have finished it, we stop work and we change the nutrition as per our. Okay? So, what does it mean? It means that normally, when we treat this kind of problems, we treat here. We treat symptoms. We treat symptoms, why? Because we think that if we are no more able to function, we have to stimulate function. But as Hippocrates say, and also in English people that called Wilson or Brian, I don't remember exactly the name, they told that the treatment comes for the outside, but the garrison, how do you say it? The healing comes from inside. Nature made itself. This is the reason why even if you take a functional treatment, whichever it is, you need some time to recover. Because we do not act here. Is it true or not? Yeah. And this is the reason why, theoretically, ideally, we should give at the same time to the cell something for their function, something for their protection, something for their nutrition. And this is the base of what we call the vertical action. At the same time and immediately and simultaneously acting on nutrition, protection and function. You understand the difference? It's an enormous difference. It's very easy. But nothing scientific. It's hot water. You know? So I'm explaining to you the hot water. But this is the key point. A very important key point. Because this allows you to earn time. And this is the reason why we can say that with Cellogie or ornithology, that is now I'm sorry because we go alone, we have this kind of result. The result we have with the Cellogie ornithology is, first of all, result in time. And as I told you before, we obtained it before the result and then we understood why. And the question that has been given to our professor, okay, was why we have such a result. And the answer was this one. I try to go again to this one, hoping not to go. Was it the first? Okay. So, what happened when we asked, we tested what happened here. So, this should be after, so sorry, this is one, alright? So we tried to understand what happened. So we put the orogranules in a culture of dermatocyte. Okay. I stop it and I show you another way. I'm sorry for this problem. I stop also this one. Okay. So there are skin cells, the culture of the skin cells, right? Keratinocytes, HATA. We put them with orogranules, with vitamin E, and obviously we had the blue one that was the normal sample, no nutrition. And look at what happened here. This is the Cellogie. This is vitamin E. You see? And look at the activity of the product at 25 milligrams. It is exactly at 400 milligrams. And this level is not reached by vitamin E. So this means also that it's not necessary to give a lot of quantity, because our cells are very, very sensitive to microdoses. Do you know which is the dosage in the blood of cortisol, estrogens, vitamin D, now is between 3 and 5 GH. GH here the dilutions, okay? So we are speaking in 10 to 6, right? It's a homeopathic dosage. And we are giving to everybody a lot of milligrams, sometimes grams. I will explain it afterwards. So first of all, this shows that we are able to double from 6 to 12 the growth and the vitality. This test has been done in acute after 24 hours after 1 week. Okay? Then, so we are showing that we are able to nourish the cell. And what happens afterwards? We put the same culture against an attack induced by the peroxide. Peroxide are a very strong source of free radicals. Free radicals are one of the elements we measure for calculating the toxic waste, how you say, the toxins in a certain way, right? So free radicals attack very strongly cells. And which is the result we have? This is our product, vitamin E, and this is the control. 50% less of free radicals. It means that we double this capability of defending. And look at vitamin E. She is not able to arrive to the same level at 1.5 milligram, right? Sorry, gram. And we arrived at it on 380 milligram. And for the one who uses Cellogie, which is how many milligrams are here? 400. Okay? 400 means that we are perfectly in this aspect. So we don't need to go whoa, up, because we don't earn a lot. And on the other side, we have seen that with 400 milligrams. We have exactly the same activity than 25. So there is no 400 milligrams in this. So this means that we are able to double the growth and the vitality of the cells and double the capability of protection of cells with one organelle. So it means that we work in vertical. Okay? And the largest advantage is that whichever is the condition of the cell, we are working on the cells, so they can take whichever they need at the time they need. Right? So you are saying, okay, very well, but what I'm interested in the clinical, right? You are right. So these are 3 examples. Probably it will stop, otherwise I will stop directly. Look at the results of joints. We have done a little study on, I stop it because otherwise we'll finish very badly. We have a little study on more than 1,000 people. 2 organelles per day, in the worst cases 2 organelles twice a day. This is the global result in patients that have been improved. This is in 1 day, 5 to 5%. 5 days, 35%. I'm sorry, you cannot see very well, but I try. It happens with the technology. So, that's better if it doesn't work alone. Okay, very quickly. The result is that after, 5 days, you have 35% of people that have no more pain and better flexibility. No, it doesn't work. Okay. I'm sorry. Here you have after 10 days 65%. And what is very important that in chronic disease, after 60 and after 90 days, 30 and 60 days, sorry, you have results that are over 80%. The green one is the evaluation of the doctors, the brown one is the perception of the patient. When we saw these results, we thought that it was not possible. Doctor said to us that certainly what you put inside, INS, or something like this. And we thought that it was not possible that we have some result. The problem is that it's a multi-cohort study with 100 doctors. So it's not possible that the 100 doctors call themselves for saying, well, I put this and you put this, right? And the study was completed with the second group. It was a group who were treated with the classical therapies. And after 1 month, we were obliged to stop it, because the result of this group, the first group, was better than the second one. So we tried to add to the classical therapy joint, and the results are absolutely overlapping with this, with a drastic reduction or stop of the chemical therapy. This is just for amusing you. This is the rugby players of the Toulon. 4 months of therapy. This is for exercise. This is for recovering of fatigue. This is the traduction in English is not very good. The capability of effort and so on, right? So the result was that they earn the championship. One, thank you. Probably they also earn a lot. On the other side, here are the negative effects of this hard effort. Muscle contracture, you say, okay? Claquage, cramps, muscle pains. But what is more important for me is this aspect. Because this, finally, you can say, okay, this is a function now. Yeah, probably, yes. I have better function. But here you have two indexes that are, in our idea, more important. The one is obviously the troubles, and the second one is the concentration power. You know that very high level athletes have an enormous problem in sleep and in concentration power. Look at it. 5 times less, double capability of concentration. That means that the intervention in the vertical is more important than intervention in the horizontal. Clear? Here is just to show the importance of this kind of therapy for people who, for children. Okay, these are teenagers hospitalized for hyperagitation, I think you say. No? Is it correct? Hyperactivity. Right? Look at the results. So they were hospitalized, so controlled with machine and so on. 10 minutes of less for falling asleep. 40 minutes more of sleep. But what is very, very important, 70% less of awake fatigue, so they were not tired anymore, and 66% less of hyperactivity during the day. This has been done by Marcel Ruffo, that is the most important, how do you say, in French we say pedopsychiatric So, psychiatrists, but for children, okay? Yeah.
Pediatric.
So this is considered one of the 3 most important in Europe. So it's not the last one or the one of the hospital in a little town around Venice. Okay. So this just some examples, because these examples are the most important because there are 3 different kind of pathologies that are very frequent and that show that you have this activity that is an activity that has been shown very quickly. So this vertical action, that is the key point of Cellogie, is due to what? Certainly the ingredients, okay, but everybody can have the ingredient. Which is the more important here?
The way it's administered?
People say way of administration.
Mm-hmm.
No.
Nope.
It's not the most important. Why? And then I will stop to make you sleep. So what is the real key point? Is the fact that we have this vertical action. Okay? Help me. Which is the vertical action? Nutrition, protection, and function. And I have an S. Functions, right? So, why can I have, or how can I have this kind of actions? I can have it not because I put 1, 1, and 3, but because I am able to create a complex, right? In a certain way, is a new natural molecule. But for doing it, we need a new drug delivery system, because you cannot have the same thing with capsule, with tablet, well, whichever you want. And which is this new drug delivery system? It's what we call the holograms. And why, in your opinion, we put this image upstairs? Why? Why this image? First one is what?
Each snowflake has an individual.
Is a snowflake. A snowflake is made by a lot of snow crystals. What do you need to have snow? Water. Then? Temperature? Yeah. Pressure? No. Keep it on the left. Huh? She said ice. No. Sorry? Glass? Light. Ah, sorry. From here I read in your left eyes. Sorry. So it's okay. So come back. Water. Cold. Temperature. Pressure. And then you need a 4th element that is essential. Now,
God's
something
particle.
that is very easy. Is what we call the now in English the powder
Dust.
of the atmosphere. Why? Somebody likes to ski? Yeah? Do you ski on water or on solid? On solid, alright? Yeah, but it's not a powder, it's not something like this, but it's solid, right? So, how can we ski on solid if we say that water is a compound? Very easy. Because this powder is the nucleus around which we are able to crystallize the water. Okay? If we have no powder, we cannot have crystal. And afterwards, each is better at a star, right? All the crystals put together alone, without any glue, just for physical reasons, right? What do you need for having an ice? Water, temperature, pressure, and a recipient. Otherwise you cannot have ice. Okay? You need to have somewhere where water can stay. I'm going to have an ice cube and a ball of snow, and you make sun right here. Huh? What happens? Which one first? Snow. It's very important, this. No. I have 50% of it what it is. So, no, this one. Why this? Because when the sun make that, the ice obtain the diffusion temperature of the salt from the inner, well, the outer. This is true because if you keep a glass of wine or water, you will find at the end the walls. Okay? And as you say correctly, if you have a snowman, the day after you will find a snowman that is little, but it's still there. So it means that the largest difference is that in this case the dissolution is from the outer toward the inner. Right? And what is essential here? You can have this natural form if each crystal has the same ingredients. You cannot have a snowflake that is a little bit white, a little bit green, or a little bit brown. They cannot go together because their structure is different. It's exactly what happens with organelles. All the other galenic form, tablets and so on, what you do, you realize a mix of the ingredients, and then you derive the units, right? You agree? In this case, we'll build up each organelle starting from 100 micron powder. And we obtain exactly the same result, so that an organelle, this one, the one you have in your hand, okay, is millions of microorganisms, so that when you suck it, you will have an assimilation by mouth. This is why the organelle dissolve progressively in the mouth, because of this allow to all ingredients to this new complex to go directly in blood through lymphatic or mucosa, right? So we don't pass for the majority the stomach. So we do not have the first and the second pass. That allow us to maintain the quality of the ingredients. Because being naturals and not being the, let me see, extract of the extract, but being as nature knows, our memory knows what we are eating, they are directly arriving to the heart of the cells. It's okay? Is it clear? Very simple. We put 20 years for understanding something that is anywhere. I put 60 years for understanding, because till 5 years ago I was thinking again, what is the receptor that has been involved there? The receptor is very important, but we have to go back. Why this? And then I finish. Can I go 5 minutes?
Carry on, carry on.
Sure?
Yeah.
But there's people sleeping, so
No, no, carry on.
Yeah, but probably it's a tea time now or beer time.
No.
Wine time.
So, the second point that is very important for me, I stopped to show to you this, is we agree that the cell is our key point. We agree that the cells have to be nourished, well protected for well functioning. Okay? Now, why do we need to take Cellogie?
Because we've been constantly wrestling with things that attacks each one of all of those levels, and each body needs assistance to actually defend itself against them.
This is a very scientific one. Very well done. It means simply that our normal alimentation has no more effect because we do not respect season. We do not respect the cell memories because our memories are linked to our life. And there is a science that is very new. It is called epigenetics, that shows continuously, any day, that alimentation can change the genetic patrimony. I don't know what to say in English. The power of our chromosome and genes, right? So we are checking with the genetic that will solve a lot of problems. Research, a lot of problems. We are looking for how to introduce this kind of piece of chromosome at every level. And on the other side, we are destroying ourselves with the food. I'm not at all ecologist, so take this idea simply as a real, true. Why this? You know, in France we have a lot of people that is now with intolerance to melon. You know the yellow melon, no? What do you say? Okay? It's quite strange, how do you say? Bizarre in French, huh? It's quite something very surprising, right? Okay? Why this? Let these people take the French melon at the right time. They do not have any intolerance. When we have autoimmune diseases, you see the celiac disease, do you have it frequent? More and more, huh? What are you going to do for these people? I will shock you, I'm sure. So you can take eggs and ready to say yes, okay? But I will shock you. So what are you going to do? Because if you are, frankly speaking, more prepared than the average people met till now. Also doctors, huh? There are some doctors, no majority. Okay? So what are you going to do for solve the problem of the celiac? Yes, lady.
Bring the body back to its natural side.
Yeah, this is what you should do. But you're right. But generally speaking, what do people do? Stop to eat this, and stop to eat this. Okay, perfect. We are not at all working on the origin, on the source of the problem. The source of the problem, in your opinion, is where? In the bowel, in the intestine. We certainly developed something that modified the behavior of our intestine towards the pasta and so on, the gluten. Okay? We are not working, looking where or how to go back. And the only way to go back is exactly as, for example, for the how do you say thyroiditis? Thyroid, autoimmune, Hashimoto, autoimmune disease, psoriasis. How many psoriasis you have now? How many vitiligo? How do you say vitiligo? Vitiligo. No, vitiligo is when you have some white manifestations. This is called vitiligo. I don't know what you say to me, right? Sorry? Is vitiligo? Okay, thank you. What are we going to do against this kind of diseases? Nothing. Why? And why do we have them? This is something that we studied in 3 years before we were completely out of this mind. We have to think to what I appreciated a lot this morning when you spoke, Dr. Ortiz, about the homeopathy and the autism and so on. Why this? We are not thinking that we have a memory to reconstitute. We had something in the past that modifies something in our behavior, in our cell behavior. So the only thing to do is to think to give again the capability to the cells of restoring themselves, because they will find their memories. Okay? This is clear. It's shocking, because we think to everything else. You know, if you have psoriasis, give to these people 2 to 6 immune per day during 2 to 3 months. Okay? Sometimes people give for 6, but this is, I think, this is just for make people come 6 times. Okay? We have to live, we have a result in psoriasis with a total disappearance of psoriasis. Vitiligo, the team, the Spanish team and the Italian team of Milano, San Raffaele, are showing that they reduce of 30 to 100% the vitiligo. But it's not our, I speak as company, merit. You say merit?
Yeah.
Okay, merit. No. It's merit simply to nature. We are simply helping what we said, Dr. Wilson, Hippocrates, we are helping the inside activity for reducing the time of restoring. So our chance was to find this orogranule and this 1 to 3 vertical action. Nothing more. Nothing more. And which is the link of the old products you have? You can have a lot of other products, but let me speak about the one you have. Which is the link? It's very badly, I'm sorry, but I told to you, presented, because they present to you the beta-midicine complex. They have not understood. So please, do not consider this. Consider only the first page of the presentation you have here, because this doesn't exist. Why am I saying it? Stronger. Because these are simply part of the complex that constitute the organelle. So, it's not the fact that you have inside, you put, if you take a capsule and put inside tomato, olive oil, and so on, you do not have the same result. Because when we build these little oral granules, okay, there are every time all the compounds. And we can put together compounds that are solid, liquids, oil, essential oils. If you want to come and see us in San Rafael, in south of France, you will be the welcome. And I will show to you how we can keep an essential oil stable for 16 years in a solid form. You have 1, 2, 3, 4. The fourth is not probably he didn't remember it, but it's not. They tested it. Okay? We arrived to put essential oils in a dry form. And after 1 year, we have a 10% of lost. Okay? Remember that essential oil, normally you have it in a bottle because they are liquids. And the problem is that they are volatile. They pass from a liquid form to a gas form very, very easily, very quickly. So when you put it in a bottle, you will have, for the simple principle of saturation, an equilibrium between, how do you say equilibrium? Balance. Between the oily and the gas form. So each time you take out some drops, you will make a gasification of part of this, so that when you are half the bottle, the activity of one drop will be 0. Okay? And this is the largest problem, because you say as therapist, take 3 drops 3 times per day. And what you say? That the 3 drops here are at high risk of intoxication, and the 3 drops here.
Could you use a red pen?
Sorry?
Can you use a red pen? Is there a red pen up there? A red stylo?
Stylo rouge.
Sorry.
Can you change the
So I have to write again, or
No, just
I
red.
understand. Sorry.
Is there a red one there?
Ah, okay. I change color.
Yeah. Can be all.
I need to invent something for my
Thank you.
here. You know, I speak all the day. I speak 3 languages, and I speak English well to people that are not English. So, again, what we call international is the Russian English, the Polish English, the Italian English, the French English that I leave you understand people, French people speak English, and the Spanish one. I can say that. This, frankly speaking, coming here, when I go down from the flight, and I listen to people saying, "Welcome to I wasn't getting. I asked me, I was wrong in keeping flight. Where am I? And this is the reality. Sorry if I don't understand. So red is okay?
Yeah.
Okay. So I mean that this is a problem. I love a lot essential oils. I love a lot also homeopathy. Why? Which is in common? Cellogie, and homeopathy. Which is the key point that is common to this? The information, yeah. Because homeopathy, and we have a very large specialist, so I might ask pardon to Dr. Ortiz if I speak homeopathy, okay? But the key point of homeopathy is it works on cell memory. If you need to give to people stressed, people who is stressed, and you want to help him to calm, what do you give to him? Coffee cruda, coffee. Oh, very mad. You give me coffee. My coffee is. Yeah. But we did it a very, very, very loud illusion. So that means that in homeopathy, I do something that is called the principle of simulation. I am bringing again the cells to their natural memory. Vaccines. We are more and more touched by the far, a lot of years after, is it correct? Problems of vaccines in pediatric ages, and which is the only therapy for eliminating these problems. Homeopathy. We recreate it. But homeopathy is against the large business of pharmaceutical company. As I am, as I come from. Right? But it's the truth. Change mind. Go back and try to explain what happens. Simply go to the basis. Yourself. Right? So, coming back, what does it mean to put it together and create this complex? That each compound exists at the beginning, but it doesn't exist at the end. You cannot find in an orogranule this and this and this and this and this, right? Because they are integrated in. They are bound, they are part of a new compound. Okay? Nature makes its own link inside. And this is the reason why we have this result. I've not spoken about this because I don't like to compare myself to the others. But we did the same studies with the same compounds from competitors and from an idea that our professor had, that was to create a powder of all these compounds. No result at all. Why this? Because when you have an association, I have a slide of it, I don't want you to use time more. When you have an association, you have, now I show you, because it's quite important. Okay, when you have an association, what happens? When you have an association, you put A plus B plus C plus D. You put together, you mix, you put in a capsule, okay? You swallow it. Now what happens in your stomach? We open the capsule, and then the organisms will recognize A, B, C, D. And A, B, C, D will have all each our assimilation curve. This is for A, this is for B, and so on. So there is no synergistic effect. Okay? Otherwise, we have resolved the problem of nutrition. Why to eat? We have everything in food supplements. Sure. The problem is that when you take vitamin C, what are you taking? Ascorbic acid. Very well. And what is ascorbic acid? The compound we have extracted. Vitamin C doesn't exist alone in the world. Vitamin A doesn't exist alone. Vitamin E doesn't exist. They are existing in compounds that nature did. Okay? So, when you take, there are natural vitamins. Sorry? Roche sells natural vitamins. Oh, yes. Oh, yes. How many people take or took aspirin with 500 or 1 gram of vitamin C? A lot of people, because till 3 years ago, advertising was, take this, 100, 200, all right, grams, 2 grams per day, right. Do you know which is now the daily recommended dosage? No, aspirin, vitamin C. Do you speak aspirin? Do you know how many molecules of aspirin we have in our body? 100 million of molecules of aspirin for each cell we have. Okay? But this is not important. Vitamin C is from 60 to 100 milligrams. Now, 3 years ago it was 2 grams per day. Ah, yes, but it's no risk because this is simply a water-soluble vitamin. Yeah, it's true. It's true. We eliminate the excess. Who is able to make a control inside cell? We are able simply to measure what is in blood, not in cell. Right? These studies, the American study shows that vitamin A, vitamin E at high dosage gave a lot of increase of the mortality, cancer, and so on. Why this? It's normal. Now there is a product based on a resveratrol, probably some know, and the marketing claim is 300 milligrams that corresponds to 10 kilos of orange. Wow! Fantastic! Are you going to take it? Are you going to take 10 kilos of oranges per day for 3, 6, 9 months, or for 1 year, or for every life? And the last study shows that probably there is a liver and a kidney accumulation. Ah, right. Right. I'm I'm not saying that it doesn't work. I'm saying that it's better to take 3-4 oranges per day. And I will have not only vitamin E or vitamin A and so on, I will have a lot of other ingredients that are very important, full of. The problem is that we are buying oranges that come from South Africa or from India or from China. Excuse me, but which are your origin? Very, very historically. India. Okay, fantastic country that doesn't have oranges. Okay. Yeah, I'm joking. I'm joking. But I mean, they stay. You know how many time pass in boats the oranges? From 60 to 95 days, right? And when I studied, 90 days mean that you change completely the characteristic of the orange and everything's dead. So this is the real problem. This is the reason why we had to change nutrition and to take food that comes from very, very, very close to us. And something that is very easy to do. Okay, we have an history. Why Japanese woman? There is no Japanese woman here. Okay? No, not perfect. Okay? Go in the United States, continue to use the soja, and they develop breast cancer or feminine cancers, as the Japanese don't do. Why? Because it's completely different, the soja in the United States, the one they have there. It is a reality, I am sorry. When some years ago we treated the problem of menopause with soja and so on, it doesn't work. Obviously, we gave soja in a capsule. It's not the same. It's not the same. It's not the same thing. Okay? So, coming back to this, which is the problem, the difference? The difference between an association and a complex is enormous. Okay? I found it very quickly because it's something that, yeah, here. Okay, so in this case, allow me not to say stop. Please.
No, this minute.
Huh?
This minute.
Yeah. Okay, this is, which is the difference? No, do not ask to me which is the product. It's not true. Okay, so look at, there are one product, second product, third product, okay, 1, 2, 3, right? This is the sample, okay? We tested it in vivo, okay? The antioxidant power against blood cells of these 3 products. This is the result of product 1, this is the result of product 2, this is the result of product 3. So, very well, we put together 1 and 2. We are expecting to have 1 plus the other. And now, it's not exactly the same. Okay, we try to put together 1 and 3. Look at a third of the highest. We put 1, 2, 3. Nothing. I cannot say which is the product, but it's one of the most important and the most sold vitamin product, stimulating product that is actually sold. And this is all granule. What does it mean, this? 2 things very important. The first one is that the organism is no more able to recognize the different ingredients. So is able to recognize the complex. Secondly, the activity of the complex is more important than the 3 ingredients. I put 3 ingredients here, okay, just for granted. It's clear what I mean. And what we found is, for example, just for joints example, the complex of joints is 670 times more antioxidant than vitamin E. Why this? Because probably this kind of activities from the first microgranules to the ovum gives an energy, and I speak energy, but you can speak of everything you want, okay? That gives this power that is not possible to have if we put A plus B plus C plus D in the ovum, okay? It's clear?
Yeah.
Just for showing two examples. The first example is what we call, I hope you call it the same thing in French. How many of you have problems that are internal and not physical of silhouette? Of living. How many of you have this problem?
What?
Yeah. One, that's okay. Normally in French you have 95 plus 5 that have this problem, and the other are men. Okay? So, what happened? Use this example if you want. If you have to suggest to people, use this example. What do? You decide, I have 10, no, 3 kilos. Okay, 3 kilos more, right? What are you going to do? I stop fat. No? Fat eating. Every people think that I ate fat, so I take the fantastic proteins, I don't remember the name, and the shakers and so on, I will stop eating clearly and so on. And oh, fantastic, I lost 3 kilos. How much time? 2 weeks, 4 weeks. If you lose before there is something that doesn't work, stop it immediately and look at the other reason why, right? Okay, fantastic, very well. And then, during this period, what you had? Some adverse effect. First one is what? Well, let me, you are certainly able to do. Stress. Ask your husband or your friend. Yeah? Secondly, sorry? Hunger. Okay? Third? Two other effects very easy in the woman. Constipation effects. Your both are working well in any case. And then, notice it. You have problems in your skin. Wow! I am 3 kilos less, but I'm not so fine as I was before.
You're 20 years older.
Yeah. So, finally, okay, I already begin to eat. And what happened? After a few weeks, I'm 5 kilos more. What do you call this, please?
Yo-yo dieting.
Huh?
Yo-yo dieting.
Yo-yo effect. So how can you explain it? It's very easy. Fat is an essential ingredient. Our cells cannot eliminate fat. It's the first source of energy. So what do? They stock it. We haven't cells that are deputed to stock the excess. So we are going to stock in the cells that are less used. So where? Woman. Huh? Maybe this just for showing that woman. Where did I put it? Here and here. Okay? And men, where do they put it? Huh? Here. Why this? Because biologically, man has to work, so we cannot accumulate fat in muscles here or in other parties that are important. You The part that has to be protected more is here, because here you have to put a baby. So this is the reason why you accumulate here. This is linked to our structure, hormonal and so on. So what do cells? They accumulate in the muscle, generally speaking, right? So you stop to eat fat, they are obliged to go to recuperate fat from the stock, so they go there. But when you begin again to eat normally, where do they put? They accumulate stock before using it for the normal need. Okay? So they accumulate more because they say, he is completely mad, this man, right? So accumulate more, and this is the yo-yo effect. So the problem of living, let me suggest as a doctor, is an educational problem. So you have to re-educate your system. And only in this way you do not have this effect, right? Second example I want to do. Who is smoking here? Who are smokers here? Nobody? Wow, the first time I tried. 60 people, no smoker. So, let me give this example, just for example. So, have you had somebody who smoked in your life around you? Yeah, okay. Which is the first thing that happens to a smoker? No, before stopping. He has, but the first problem is that he has a mouth that is always dry. Huh? The voice is and so on, right? Why this? This is very important. If you have understood it, I did, frankly speaking, something very well. So, bravo, Gaetano. So, why?
The nicotine stops.
No. I understand. You are all scientists. Perfect. Stay down. Huh? Your client doesn't have this kind of reason, right? He's simply, okay, simply thinking. What happens? Huh? What happens? Normally, I use water for cleaning, right? Okay? Look at me. What I'm doing, I'm introducing the air at 80 degrees. If I keep water in my cells here, I will have an effect barbecue. And I will destroy all my cells here. So the cells stop it. Okay? Stop to use water. Right? Secondly, what do I do when I smoke? Look at me.
Inhale. Inhale.
I swallow. What I'm swallowing? What I'm swallowing? Everything is all the micro particles, molecules that are in the smoke. Arsenic. What's that? All the things that she showed very well this morning. Alright? Huh? Smoke creates a lot of free radicals. And why people, when stop, has two clear effects. The first one is, I stop smoking, then I have one first reaction that is,
Eat more.
eh?
Eat more.
You are angry, okay? You are angry, more angry. But then the second effect is immediate. Cough. Why? Now it's up to you to answer to me. Why? Why? You are quite right, but go to the basis of it. Why they have always this need of coughing and crushing? Spitting. Why?
Trying to get the toxins out.
No, it's right, but the toxin is a result of cells finally perceive that they need it. They can use again water for cleaning, so they use again water. When I was a young surgeon and I had a lot of cancer, and at the time there was no chemotherapy, so we cut, okay? We, as a doctor, we said to these poor people with a lung cancer, we say to them, you understand? You have to stop smoking. Okay, so stop smoking, what does that mean? And once, one people came to me and said, Dr. Zannini, you're completely stupid. Yeah, why? I stopped coughing. Oh, yes, I'm very happy for you. Yeah, you know what I did? No? I smoke again. This is the memory. Just forgiving the second element is not nicotine that gives you all the problems. By the fact that in the years and years of smoking, you have given the habit to yourself of being nourished by what you introduce with the smoke. So you have to change the habits of the cell nutrition. And we have a product that is called no tobacco, which has the same result that the patch of nicotine. And I am very happy that you are no smokers, even if commercially speaking, it is a pity. Thank you. Thank you to all. It's very kind of you, so gentle with me. Thanks so much.
I'm going to do some questions and answers, okay? So, is that all right with you?
Yeah, for me it's okay. I need a simple to understand.
You have different kinds of Cellogie. Do you also have anything to tell the practitioners how to prescribe them to the clients?
I forgot one thing. Thanks for this. So when I spoke about ingredients, the different products have all the ingredient that has been shown important for nutrition, for protection, right? These ingredients that are common to all our organisms are the one we call the beta-midotrim, but it's not at all a complex that is inside. So you haven't something that is a complex or base as it's over there. So this is simply a group of ingredients that are all inside in all organisms, okay? Here you have a certain difference, okay, that are what we call the functional ingredients. The functional ingredients we use are functional ingredients that have been shown during years and years and years effective. So do not ask to me to put the alzazina or coming the baia or Brasile. No, we use something that has been shown since years and years and years. Okay, so we use different ingredients. I will explain for each, right? But I'm trying to explain to you when we think to a new molecule. Let me see. We think to a pathology. We do not consider symptoms. We consider the source of the problem. So, just for giving an example, it's not a good design. I prefer to change because otherwise you would say to me that I take an articulation. Okay? When you have problems in articulations, which organs are interested? Help me because they are saying me that it's time and so on. Now, this is articulation, okay? When you have an arthritis, for example, which is the problem? Where is the problem?
The joints.
Joint. Okay, joint. But the joint exists why? Which is the function of the joint? Allow the movement of what? Bones. Bones. And to allow bones have this movement, you need what here? A membrane, okay? Synovium. Alright? But it's not enough. Because if I put bone, and the joint, it doesn't work alone. I need to be there and put this on this side. On this side, imagine if I needed to make her work, and I muscle. What do you need? Also, cartilage is a compound here. What do you need? Lubrification, right? Synonym, right? And from where can lubrification? From the vessels. Microcirculation is more important than other parts. Otherwise, how can you think that it is living here? Huh? And you have also the nervous system, right? What happens when you give all the anti-inflammatory drugs? They work where? Here. But when you have problem in joints, you have the top or the down of the bone that is it is in this way, it's no more. Because this inflammation and the free radicals that this kind of disease produce any time, right, provoke this disease also in the bones. Muscles is sure that they are obviously interested by the fact that you cannot anymore move. So they become old. They have no stimulus. If you are not able to make ingredients come here, and you don't have a good circulation system, you can't do anything. So when you conceive it, we conceive, and if you look at the ingredients, sometimes we have 7, 10 ingredients. It's simply because we tested that the wool acts here on inflammation, here on pain, here on the vessel, and so on. And which is how can we do it? Because we can choose everything we want. So we can choose essential oils, solid, liquids, whichever we want. So we have an enormous portfolio of actives to use it. Understand what I mean? So that when you simulate a joint, you are treating all these aspects. And this is the reason why the result we have. Yeah, I understand. I understand your answer. So this is the reason why we have this kind for all products. So in terms of utilization, because this was a question, for women, pre-menopause and menopause, 1 to 2 twice per day. Okay. Also for younger ladies that have some menstrual, how do you say, menstrual problems, you can get without any problem, right? This is the major indication. So the indication is when you have a red face, now how do you say it? Hot flashes, humor. As therapists, pay attention, a lot of women who begin to have 40 years and to have some, even if they do not have effective disturbs, okay, they may have simply a humor modification. It works, right? Sudore, how do you say it? When during a night you
night sweat.
Night sweat. Okay, right. And you have a result in 10 days. I suggest to continue for 2 cycles almost, right? Okay, I answered for this. May I take the time of explaining? Yes. Memory, brain. Brain is indicated for all people over 60. This is the reason why I lost my memory, because I do not take it. Okay, now, very, very well done. Elderly people do not give the unwind, do not give unwind. They need energy. Give on the other side, recharge, all this, right? The posology is always the same, 1 to 2 twice per day. If you want to begin 2 times per day, you can begin. If you need an effect very quickly, okay, then you go to 1 to 2, one twice a day, right? So this indication is fatigue, stress for school, stress for work, too much demand, and so on, right? Optimize. Optimize is a first step product. Are there any osteopath or kinesiotherapist here? Okay. The school learn that you have to begin to detoxify people. They are right. So this is an ideal product to begin the treatment. 1 + 1 is enough. Okay? Yeah, I mean, you can take 1 optimizer circulation or optimizer detox per day. It's not necessary to go over. Only if you need to have an action very, very quickly. In this case, we need 2 of one and 2 of the other, right? Okay? Possibly give the product 1 in the morning, 1 in the afternoon or evening, right? Because there is a cycle to respect. Okay? It's better than take any product exists that gives an action for 24 hours. It's not true. Immune, very important at the time. Bronchitis, flu, and so on. Two times per day. If you have a very important cold, you can take till 6 per day, 1 per 1, and you will feel immediately better. You try before giving to people, but you will see that the effect is immediate, right? Due to the fact that there are also sensors and so on. It's a chronic therapy for all diseases linked to pathology of bronchitis and so on, and asthma or allergic diseases, or as I told you, psoriasis or something like this. You do 2 twice per day, and then you pass 1 after one month. Okay, and you can give it a long time without any improvement. You will see there are a lot of studies, also in pediatric stage, that we reduce over 40 to 70% in average the infective events during the winter. Then, heart. This is a very specific product for reducing hypertension and hypercholesterolemia. How do you say in English? Cholesterol. Okay. This is a treatment, a long-term treatment. This does not mean that you have to stop all the other therapies, okay? But you can accompany them, right? The last one, sorry?
Is that also one?
Yeah, one, 2 twice a day. If you want to have a test, you do 2 times. People perceive immediately the difference. Is it true? Did you perceive the difference when you take this product?
Notice.
Yeah. And you take it, no?
That's it, same thing.
Did you take it or no? I remember well. Okay. Weight loss. Weight loss is based on the concept that I gave to you, but it's more based on the CLA. Okay? The CLA acts on transforming the fat, what we call the mass fat, in mass of the muscle, so thin muscles. You can arrive to 6 per day. 2. And take it before eating, because it has also an effect of reducing the sensation of of hungry, right? Okay? So,
thank you very much.
Joints is 2 twice per day. For one month in chronic pathology, and then you pass to 1 month. Last question, because I will answer to you when we have a small, because I will be killed very soon.
Before meal, how this before meal?
Before eating? Or?
It's not at all important when you take them, because you are assimilating directly by the mouth. So there is no reactions with the stomach, with what you eat, so take it whenever you want. You can mix them without any problem. The only problem you can have if you put 2 different products in your mouth is an interaction of taste, and nothing more. Okay? Because CLA is weight loss, so this gives also the possibility of reducing your sensation of it. This is the only one that I suggest before simply for hallucination. Thanks a lot. I'm obliged to stop.